Good morning. I'm Glenn Poole, CEO of the Australian Men's Health Forum, and you're joining us on day 4 of Men's Health Connected 2021. Today's event is entirely focused on nursing for men's health. Before we start, I'd like to take a moment to acknowledge the traditional owners of the lands where we meet from around Australia today. I'm joining you from the lands of the Gureng-Gureng, the Grang, the Bunda-Bunda and Balai people here in central Queensland. So we've got 5 fantastic sessions on the topic of nursing and men's health running throughout the day. Coming up, we will have sessions which focus on research around nursing and men's health. We'll have a focus on father-friendly approaches to working with father-friendly approaches to nursing, working with dads. We've got a focus on nurses' well-being and career paths. We've got some great lunchtime talks looking at different male-friendly nursing projects from around the country, a focus on nursing and prostate cancer, and finishing the day with a conversation around the role of male nurses and whether they're good for men's health and gender equity. But starting the day, we have an excellent panel lined up for you to discuss the topic, improving men's health, what role do nurses play? Joining us today, we have Helen Stuart, who's a board director of the Australian Primary Healthcare Nurses Association, Stuart Willder, who's a men's health and urology nurse practitioner with Western District Health Service, Dr. Garth Kendall, who's senior lecturer at Curtin University, and John Brown, a clinical nurse consultant and fellow at the Australian College of Nursing. I'm going to start with a really easy question and simply ask our panelists to just introduce themselves to you so you've got a sense of who they are and why they're drawn to this topic. And I'm going to start with Helen Storer. Helen, welcome to Men's Health Connected.
Morning.
Just take a minute to tell us a little bit about yourself.
I live in Perth in Western Australia. I grew up in rural Western Australia. I actually come from a long line of nurses. I've been a general practice nurse now for horribly 31 years. I have two adult sons, an adult daughter. I'm passionate about men's health. I see the reluctance for them to come to general practice and have wellness checks. So you've really got to be opportunistic. I am involved in the Healthy Male Nurse Reference Group, and I've been involved in the Paternal Plus research program. So, yeah, great passion about men's health and how we can do it better.
Right, thanks, Helen. And I think you'll hear the Healthy Male Nurse Reference Group mentioned a couple of times today because we've got 3 or maybe 4 representatives from that group. And for those who've been around men's health a long time but haven't kept up with the changes, Healthy Male is what used to be called Andrology Australia. Thanks, Helen. That's a good start. We've got a sense of who you are. So John Brown, who are you? What do we need to know to understand who you are and where you're coming from? And you haven't unmuted, John.
How's that?
Yeah, we're on.
Firstly, I'd like to acknowledge the elders from where I am in the Turrbal people, and Yagara and Kondamuka, which is the Brisbane area and the Bay of Islands. My nursing career actually started in the Army as a medical assistant as a national serviceman. From there, I went on to do my general nursing in repat hospitals, and did a graduate diploma in health promotion, and then commissioned a community health centre in Goodna, which is part of Ipswich City Council area. Part of that role was also, in extra time, was doing men's health talks around the region. and I relied a lot of the work on Steve Biddulph and Richard Fletcher from the University of Newcastle. So that was back in the 90s when we started doing some men's health work. I've also been the Assistant Director for the Commonwealth in the Population Health Division, looking after the men's and women's health policy, where we actually funded the Australian Centre of Excellence in Male Reproductive Health, which became Andrology Australia, now Healthy Male. When I came back to Queensland, I managed a community health centre in Warwick, in the rural area, and we instigated a men's health program that involved education over 12 weeks and introduction to physical exercise every week as well. So they got exposure to doing physical exercises, and we had some great results from that, and actually local government won a National Heart Foundation award for that program. I still remain active in the Australian College of Nursing, hoping to push men's health. And for the last 5 years, I've worked in general practice, pushing men's health programs, and, for instance, running a hypothetical program on diabetes for men. And like Helen and like Garth, I'm part of the Healthy Male reference group as well. But I also actively work with the PHNs, the primary health networks in Queensland, to bring about change if we can.
Right. Thanks, John. A really long history there of men's health. I'm
now retired.
Understandably so. Understandably so. We were talking. We had a session yesterday on the men's health sector. Different groups that are set up to specifically work in different aspects of men's health yesterday, and we spanned 60 years because we had a session. The initial session was what's happened in the last 5 years, but we started with our president Greg Milan reflecting on his own personal journey in men's health going back to 1971, and then our final session was, what will men's health look like in 2030? So we spanned 60 years yesterday. So I think it's really great to hear different people's journeys and the history of our sector, because there was a time when, men's health wasn't a thing, or men's health then simply became maybe prostate cancer or something like that. And the world of men's health has really grown and expanded. And it's, thanks to the work of people like you who've been involved in policy and those men's health talks and all that type of stuff. So it's always good to be reminded of how the actual idea of men's health has grown and evolved. And a good reference there to both Steve Biddulph and Professor Richard Fletcher, who's still around and influencing and stuff. So yeah, thanks, John. Good to. I think probably is it the first time we've met? I'm not sure.
I was on Monday's session, but yes, yeah. I haven't met you personally.
Right.
I might have to do a trip up. I might have to do a trip up to Garang country, which that painting in the background is from Garang. You'll recognise Mon Repos.
Mon Repos, yeah, we're just another 90 minutes north of Mon Repos. So yeah, you're welcome anytime, my friend. Open invitation to all of you, if you can actually get this far, come and see us in sunny central Queensland. So I'll move on to Stu Willder. Stu, tell us a bit about yourself and what do we need to know to get a sense of who you are?
Yeah, look, thanks for the invitation to have a chat, and thanks to everybody in the audience today. I can see many people that I've met before through many conferences and events along the way. Look, I'm not sure how to start, but I've obviously had a career of nursing for the last 25, 30 years, and started predominantly in an intensive care and emergency field. And obviously that's what got me into the interest of men's health, because there was a sort of a disarray of numbers heading towards male. So I wanted to find out a little bit more about that. That's led to a fairly wide and varied career now in the field of nursing. I work as a nurse practitioner now. And I've moved out of the intensive care and emergency more into a urology and men's health focus. So I do a great deal of work with in the urology field. I work for 2 urologists, and for those people who probably don't know where I'm from Hamilton. It's not Hamilton Island, it's in Western Victoria. It's pretty damn cold here today, look, it's a great place of the world, and I love it. So we've got a wide and varied community down here, it's fantastic to work in this field. So I've been doing it for probably about 20 years, and a lot of it started obviously in the nursing field of intensive care and emergency, and then it's moved out into the urology and men's health education. So a lot of that stuff is being wide and varied into schools. I have a community-based sort of clinic that I run in schools. I obviously work in the urology field and do a lot of flexible cystoscopies and some assist with surgery here in Hamilton. I run a designated men's health clinic with our GPs who accept us quite comfortably as nurse practitioners. So we're actually on a collaborative level with our clinic. I run a sexual health clinic with 2 urologists. So a lot of that's with erectile dysfunction and penile rehabilitation post radical prostatectomy, plus anything related to urological concerns for males. I do a lot of individual counselling and also workplace screening. So a lot of that is skin cancer screening, and that's right across sort of Western Victoria. And I link quite well with some dermatologists around here. So look, my field sort of started in nursing and it's expanded. There's plenty of opportunities in men's health. I originally co-authored all the Sustainable Farm Families program, which has gone into the National Centre for Farmer Health, which is based here as well. And that was really quite rewarding, but I certainly find no problems in finding plenty of varied day-to-day activities in my job. So thank you very much for the invitation.
You're very welcome, Stu. And again, yours is a name that just pops up all the time if you're sort of like deeply embedded in the men's health sector. Your name's popped up so many times. It went putting forward talks to do at our men's health gatherings. You're always a name that comes up when we talk about nursing and men's health. So it's great to have you here. And while there's clearly lots of overlaps between the speakers, it's great to see the diversity as well. We've got that sort of regional diversity, and I'm working in schools and workplaces and around different conditions, rural community, urban community. So a really good mix in the panel already. And I won't read out every comment, but Helen, there's a comment to you, and I actually just want to read it out so everyone can get this, including those that can't see the comment box. This is from Lindsay Gardner, and it really speaks to the question of the panel, which is about the role of nurses in improving men's health. And Lindsay says, Helen, my high blood pressure was identified by a nurse in the workplace. When I was diagnosed, I saw it as a personal failure on my part and evidence of my limitations as a male. The relationship with the nurse was critical in getting me to take further action. We'll come to the question later on, but I just really love that we've got a man in the audience who's sharing his experience and the difference the nurses make to keep this conversation real and connected to what we're talking about, which is men's health. Lindsay, thanks for that, and we'll come back to your question as the conversation unfolds. But first, we've got to get everyone introduced and present. So I'm going to go to Dr. Garth Kendall, who I've met before in the world of the Australian Fatherhood Research Consortium. Nice to see you in this space, Garth. Thanks for being with us, and take a moment to introduce yourself.
Okay, thank you, Glenn. It's good to see a few other bald heads around here, people of my vintage. I'm here in Perth in Western Australia. I've been a registered nurse for almost 40 years. I did my nursing training in New Zealand, but I've worked in New Zealand, the UK, and I've been here in Perth in Western Australia for the last 28 years. It just happens I'm married to a registered nurse. I've got 2 adult children. We don't have any grandchildren yet. My nursing practice in New Zealand before I came to Australia was in public health, and I worked in community child health. But one project I was very involved in. I set up a mobile health screening clinic. They gave me funding, and I had a caravan that I towed around, and I parked it in workplaces, in their car park, and a whole variety of different industries. And I had men coming out to see me, and I was doing health screening. I could do cholesterol testing and blood sugars and everything else. And of course, I could speak to the men about their mental health sort of issues as well. So I got very passionate about public health, population health. When I came to Australia, I was very fortunate. After a year or so, I got a job at the our Telethon Kids Institute here. Some of you may have heard of a woman, Fiona Stanley, who's she was Australian of the Year a few years ago. So I started working with Fiona at the Kids Institute, managing a study. It's called the Western Australian Pregnancy Cohort Study. They recruited 3,000 women when they were 18 weeks pregnant, and they followed the women in pregnancy and the children through childhood. And I'm very fortunate. It's now regarded as one of the most important studies of human development that's being conducted in the world, because it's ongoing. So I managed the study from the time the children were about 2 years of age, employed a lot of nurses to work with me to collect all of the extensive data in the study. But eventually I did my PhD using the RAIN study data, and I was focused on the impact that parents have on their children's health and development. So I was fortunate. After that, I did a postdoc, and I became an investigator working with a whole variety of people on RAIN study projects. So I'm now a senior lecturer at Curtin, and I'm involved in research and teaching. I've got a number of publications over the years that are specific to men's health and fathering, specifically around parental work and fathers' potential impact of non-standard work hours on children's health and development. And just, it might be of interest to note, in the RAIN study, we found that it was actually fathers' long work hours and not mothers that predicted behavioural problems for their children at 10 years of age. So that was quite important. I've got publications in men's health, specifically around prostate cancer and FIFO work, and a number of publications in fathering, specifically with a PhD student who's a psychologist now, who has become a good friend and colleague. So I currently teach. I have 240 undergraduate nursing students. I'm very fortunate. I teach human development, so I have a great opportunity to have a very big impact on these students. And as you can imagine, I do with regard to men's health and fathering. And more specifically, I'm involved in some major programs that are now national programs around fathering. So for the last 4 years, I've been engaged by the Fathering Project. I'm not sure if you've heard of this organisation. It was based in Perth, but it's now based in Sydney. It's got Commonwealth government funding. They run a dad's school group program. It just brings dads together in primary schools. They can get together with their kids and sort of chew the fat and talk about what it's like to be a dad with kids. So these are support groups. So I've been working with the Fathering Project and evaluating the dad's school group program over the last few years. In addition to that, as other people have said, I'm also involved in the Healthy Male Plus Paternal project. I've had a big win on that in Western Australia just in the last week or so. I've formed a group of academic nurses and midwives as an advocacy group to try and move father inclusive practice further forward in Western Australia. And a colleague and I had a meeting with a chap, wonderful man, Graham Boardley. He's actually our chief midwife in Western Australia. So it's a wonderful thing. Now, it just turns out he's bald, or he's not bald actually, but he's the same age as me. He's an old man, but he's been around for a long time. But he is absolutely passionate about men's health and fathering. And he has connections throughout the whole state. So we're now talking about doing a scoping project in Western Australia. We think we'll get state government funding. We want to look at father inclusive practice in perinatal, child and adolescent health services. So we'll be talking about like midwifery services, our children's hospital, pediatrics, and also community child health. Now, I know with my nursing colleagues, and because I'm very much involved in community child health with community nurses, they are absolutely passionate about moving forward in this field. So what we're going to do, as I said, is a scoping project. We'll find out what the lay of the land is at the moment and services across the state to see how much men are currently being involved in all of these health services for families, and then we'll take it from there and we'll look at interventions so we can ramp this up. So I'm very, very, very excited about that. And just one more thing, I'm involved in a men's health initiative. Sorry to drag on, but I work with an endocrinologist. He's a wonderful chap. He's a professor at the University of Western Australia, and he's an endocrinologist, and his research is around testosterone, and so he's very, very interested and involved in men's health. So I have an initiative that's underway at the moment. We're seeking funding from a health organisation here in Western Australia that are very interested. We want to do health screening, start with health screening for men in the workplace. So I'm going back full circle to where I started this journey, like about 35 years ago. We're thinking if we can reach men in the workplace and provide that sort of service to them, we can move forward just from screening, and we can start with interventions around maybe diet and physical activity, and also look at fathering and look at workplace culture as well. Another thing we're interested in is the relatively low number of men who take up parental leave in Australia. So there you go. Sorry, it's a bit long-winded, but that's where I'm at.
That's fantastic, Garth. Thanks so much for that. Really exciting to hear about the father inclusive stuff. And we've got an entire session dedicated to father inclusive approaches later today. So if that's piqued your interest, make sure you get into that session. So where do we go from there, right? So we've got, what do nurses do? What do nurses do for men? Well, what don't they do for men? We could approach this in lots of different directions, right? Many of you have talked about engaging with men in different settings. Workplace has been a very common one, but you've also, talked about going out into the community and doing men's health talks. You've talked about engaging in schools. So we could look at approaches that are settings-based approaches. We've had a little bit on different stages of life. Certainly fatherhood from Garth there, but we could talk about engaging with young men or engaging with men going into later life and retirement and aging. We could certainly pick up a load of different health issues. We've had blood pressure mentioned. We've had different urological issues mentioned. There's a whole skin cancer screening. There's a whole raft of health issues we could look at. And we can also look at different populations of men: rural men, Indigenous men, FIFO workers. There's so many different ways we could slice this conversation up. So I'm going to leave you to decide where you want to go. When I look at that sort of massive notes I have on my piece of paper, it kind of makes my next question so almost impossible. So I'm just going to rely on you to hone in on one piece of the great big jigsaw puzzle that you most want to speak to. It sounds like a really simple question. It's what's the key way that you see nurses playing a role in improving the lives and health of men and boys? Now, you can just pick one example from personal experience if you like, or you can talk more broadly about the nursing profession. There's over 350,000 nurses in Australia. So thinking specifically about the impact, what are the key ways that you see nurses playing a role in improving the lives and the health of men and boys? And I'll come back to where we started, which is with you, Helen, and take a bit longer now because we only got a minute of you. So have a good crack at this.
Look, I think even just the question in the chat about the nurse being the helpful person about blood pressure. I think building those relationships in being a nurse in general practice or any community setting is really important. I don't think anyone's going to, knock on the door the first day and spill everything about their health journey, but it's being accessible, following up. I am fortunate that I work with my husband, so I'm not so worried about the dollar value of my time. If I feel somebody needs a phone call, how are you going? I saw you on Monday, was a bit worried. Can we just check in, again, we did a few things, but, I really feel we need to say, come back and do a skin check, or come back and talk about, the fact that you're getting up 5 times a night to go to the toilet, or, relationship, and actually going on that journey with them and being an advocate for their, accessing other care. I mean, I'm sure we had a quick look at the budget and saw that, they want to spend $2.3 billion, but the problem we have is actually on the ground accessing appointments with mental health providers. And I can see John shaking his head. And look, it must be, a million times more difficult in rural and remote Australia. Thank God for telehealth and, the ability to reach out to FIFO workers, workers in rural communities who don't have access to healthcare. I personally see that people, word of mouth. We have one, patient that lives in rural Western Australia. Well, he word of mouth said to somebody else, oh no, come to Perth and see this doctor, come and see him face to face, and then you can see, the nurse will ring you and we can work through it. I think there's lots of really great work being done with men's health checks. Healthy Male have the Spanner project, and lots of agricultural companies get involved with providing funding for that men's health check. And I think that's really important. I love the idea that men should be involved in parenting, and we have great advocates. Maggie Dent, has written lots of books about raising men. I think we have to start their journey very young at school about what wellness looks like, what fathering looks like, asking the question, are you planning parenthood, in the next 12 months, and then helping them on that journey. I think being able to support men, send them in the right direction. Men like to do, private research. So, putting the information in a brown paper bag so they can walk out without it saying, prostatitis, what do you need to know? Or sending them to the, emailing them links to good information so they can read in the privacy of their own home office. I think it's a really healthy way to go. And we are making changes. I think it's great that we're seeing, in our practice, we do see predominantly more men. And I suppose, I'm older now, so the men don't mind telling me, about how many times they get up to go to the toilet or their problems with their sex life. I think probably if I was like a 25-year-old, maybe not. But I think it is building those relationships, and you do have to have a little chuckle when they say, "Oh, I feel comfortable enough to tell you this." And you go, okay, yeah. So, yeah, I love going to work every day to know that I'm helping just a little bit. And you get those phone calls, oh, thank God it's you that's answered the phone, because I know where I'm at with my journey, and this is the issue I'm having.
Yeah. And Helen, you talked about relationship there in the context of health practitioners. Do nurses have a greater opportunity to build relationship?
I think so. think we're not perhaps quite as time poor as the GPs, and you can help the patients, they identify what they might need to discuss with the doctor. You know, like say, yep, this sounds like this is really bothering you. Let me just, have a quick chat to the doctor before you go in, or you catch the doctor in the corridor, or you write him a message and say, actually, he's really concerned about this. Can you spend some time on this? Or I've made him another appointment to get a skin check or whatever what can wait. I think it's being able to prioritise, have that chat and know what's really bothering them rather than them. And I think we've all had this experience where they get into the room and it's really the thing they say on the way out of the room that's the most important to them. Oh, yeah, by the way, I've got a lump on my testicle, but they've already chatted to you about, 50 other things, but that's the thing they came for, but they just felt uncomfortable. And look, I think I am lucky because I have worked in the same practice for a long time. They trust us. I mean, in fact, I had one guy the other day who said, if you and David told me to go and stand in front of a bus, I would. Like that. That's how much faith they have in what we're saying. This is what we think you should do. So, I mean, they're the feel-good stories. I mean, we all have heartbreaking stories where you think if only they'd come sooner or if only they felt more comfortable. But I do think, we are getting better at it. I think men are willing to share their stories more. That we have AFL players who've talked about their depression. We've had, here in WA, one of the headmasters of one of our big private boys' school has come out and said, yep, at 17, I tried to commit suicide. I was lost. And, I think that's a pretty brave thing to do, to come out in front of your whole school and your whole state and say, yep, I struggled with mental health. But look at me, I got some help. I, got on with my career. I've moved countries. I've got a family. I'm successful. I manage my mental health. I've got a good balance in place. And I think that's what, we need more of those stories. And I think we are getting better at that.
That's great. Thanks. Thanks, Helen. And a lovely comment for you to read from Faisal in the chat box there. So Helen, it's about relationship building. Sometimes it's about those informal conversations being the sort of the gate opener between the patient and the GP. It's about understanding how men approach self-care, enabling ways that self-care, such as private research, making that easier for men to do. It's about getting out in the community and doing men's health checks. It's also about helping men get more involved in parenting and sort of thinking ahead and planning around things like fertility and parenthood and all the rest of it. So lots to chew on there. I'm going to come to you next, John. Thanks, Helen. How do you think nurses can make a difference in improving the lives and health of men and boys from your experience, John?
Thanks, Glenn. I just want to come back to what Helen said about mental health type stuff, for instance, and about accessing. Yeah, I was shaking my head because I had a friend, 30-year-old, just recently, anxiety, panic attacks, and trying to get him in to see a psychologist while the acute stage was there was impossible. And when he finally got there, it was like, it didn't help all that much, and I'm not sure if I'll go back. But that's the important thing, is that we need to educate our patients that the initial phase, the initial consultation with the psychologist is getting to know you. The other work comes later. So that's one of the things that we probably need to educate a lot more about. The other things that have changed over the years is the doctors. I mean, I've got 50 years of nursing. The doctor-nurse relationship. When I started working in general practice 5 years ago, they welcomed me with open arms because I was able to spend time with the patient, sit down with them and document everything. So when they got to see the GP, 10 minutes, the GP had all the information and knew what they had to do, and they welcomed the stuff that I did for them. One of the things I wanted to say was that firstly, we need to recognise that men's health is not just a nurse's responsibility, it's every health professional's responsibility. So it's opportunistic. Whenever we're talking to a man, whether that be in a hospital, acute care setting, aged care, Indigenous health centre, wherever, we need to take the opportunity to raise issues about men's health. There's a long history of men not attending their GPs, putting their own health needs first. Now, there's a community organisation growing called Mr. Perfect, and I'm not sure if anyone's heard of it, but I've got one here in Caboolture I go to, and it's about mental health. And I asked the question at the barbecue the other day, what prevents you going to the GP? And it's still the old story of, I haven't got time, I'm the breadwinner, I've got responsibilities for the family, all that stuff is still coming up. And the allocation of 10 minutes with your GP doesn't give you enough time. So I think there's a need that we really need to start educating men about how they approach their GP. Choose your GP wisely. Go and research, are you going to get on with that GP? Then when you go to your initial appointment with your GP, make sure that you've got your full medical history, your list of your medications, your allergies, and your family medical history. That's going to help the GP a lot and the nurse in trying to identify where do we go from here. Young males. Stu was talking about working in Hamilton, and I actually had 2 months on Hamilton Island last November where I had the Brisbane Lions. I'm not sure if I'm meant to say this, but I got the feeling that, 20, 21-year-olds playing AFL, that's their life. They know nothing else. And it came apparent to me that there's an opportunity to talk about, social interaction, how you relate to other people and other things outside AFL. One of them saying, I wish I could get a girlfriend. And that was their priority. So there's some of the other things. But also look at when do young males, when do they come in contact with the health system or with a GP? And basically it's 13, 14-year-old when they're coming in to get the HPV immunisation. So they're getting a needle. It's trauma. So what's their experience of being with the GP from then on? So we really need to start looking at how do we develop relationships with younger males over time. And maybe it's, having other billing numbers or whatever. But it's also the good thing about nurse is that we know how to relate to people at their level. Young guy comes in and it's like, have you played with yourself lately? Have you checked your balls? Keeping it simple, not, how's your scrotum? How's your testicles? Any lumps and bumps? It's putting it simple in their language so that they understand what you're talking about. In my practice, I've looked after 300 diabetic patients. A lot of them were males, but a lot of my practice was developing rapport with all the patients. That's the key thing. If you can't develop rapport with your patients to start with, then you've lost them. They're not going to come back. I use a lot of humour when I'm talking with my patients to get them in. But I also make sure that I've got good referral pathways. So I've developed very strong links with exercise physiologists to ensure that our diabetics are getting their type 2 education exercise program. Very strong links with the diabetic educator who's also a dietitian. All those sorts of things are important to know where you're going to send your patient. And you know what they do, they know what you do. So I talked about doing a hypothetical on diabetes. What I did in that situation was bring together all those health professionals that are involved in the diabetic cycle of care, so that they each spoke about what their role was and everyone knew what they were doing. And that worked really well because they knew what I said at the initial appointment and the following appointments, and I knew what they were going to say. So what we were doing was reinforcing every time they saw the patient with information. The 45 to 49 year health checks are good. However, they're limited. What I was finding was those that would come for those health checks were the fit ones. They didn't have any problems. And funny enough, those that were coming were from overseas. So they needed to have a healthy lifestyle. Unfortunately, I wasn't getting to the people that really needed it. And of course, the 75 plus health checks, you're leaving it a bit late. They've got, beyond, all you can do is maintenance in any respect. Just to come across from the Australian College of Nursing is that they support quality access and safe aged care for older Australians. The role of nurses in promoting healthy ageing. There's the community and primary healthcare nursing, which I belong to, the community of interest. We don't have a men's health community of interest. Yes, we have men in nursing, but it's about men working in nursing, not necessarily looking at men's health issues. So that's something we can take up and promote a bit. The other thing that I'm passionate about is Indigenous health and veterans care. So I'm happy to talk a little bit more about that a bit later, about how we can improve the services and particularly on veterans health. And I've got some resources that I can show. So I'm happy to leave it at that point.
That's great, John. Thank you. So rich. I mean, building a lot on the relationship piece that Helen started with, talking about the need to build rapport and how you need to, how you're adapting yourself for different populations of men at different stages of life. And you talked about really sort of straight talking in blokes' language, but also the use of humour. And the use of humour is something that comes up a great deal when we talk about approaches to, male-friendly approaches to work. And I was delighted to see, I think it was Tuesday when we had our preventative health day. There's an excellent project in WA called Man v Fat, which uses soccer as a way of engaging overweight and obese men in a five-a-side footy league. Sorry, footy's my English slipping in there, a soccer league, and they don't only win points for winning the matches, they win points for losing kilos. They reckon they've lost a combined weight, this is academic, so I trust them, they've helped men lose a total of two rhinos worth of weight since they started the project. But the point I'm making is within that, I mean, Man v Fat's actually in itself quite a bantery, humorful kind of project title, but they've actually started to research the role of humour in the groups. This is the first time I'd actually, we've talked about it for years, the use of humour in engaging men, but it's the first time I've seen a researcher actually start to present some findings on the value of humour and how it works with men. So that's a really good point. And I want to re-emphasise the point you've just made, that the importance of change at a systemic level and the idea of a men's health community of interest group. I think it's really important. We find that over and over again across different aspects of the health system, that those sort of those special interest groups focused on men's health beyond sort of particular conditions like prostate cancer and so on don't exist. And I think they're really important to get practitioners thinking about and sharing their experience and expertise, so the best practice that people like yourselves have developed gets passed on throughout the sector. So happy to support that idea in any way we can. Go, John.
One of the things I forgot to mention was the diabetic cycle of care, and I can see Del Lovett's on here as well. But Del and Faisal and I have, Del wrote a new tool, education tool for diabetes in men, and it's dealing with erectile dysfunction sort of stuff. But, it's coming back to the plain language again. Hi, Del. And Dell's going to be talking later today about that, I think. But it's really asking the question of every male, can you maintain and get an erection? And we don't ask that question enough. But put it in simple language. Does the old fella still work? Is probably what we should be saying to the older guys. So we're still using a bit of humour, but we're talking at their level.
I get it. And the point being that it's an indicator of many other health concerns like heart condition, diabetes, and all the rest of it, right? Yeah, perfect, John. Thank you. I'll come now to Stu. What have you got for us, Stu? What's the role of nurses in improving men's lives and health? Oh, you need to unmute, Stu. We missed the first bit.
I thought I did, but it didn't. So anyway, yeah, look, Helen and John have got some great points, and I totally agree with those. I think they're fantastic. I think from a nursing point of view, there's numerous opportunities. It doesn't matter if you're in a clinical situation, such as, working on the ward, and I've just been over to the ward, seeing a couple of patients, and then, I whip into theatre and we do something. And then, so there's plenty of opportunities to actually engage with men. I try and look at the opportunities that men of engaging males and boys, and I try and divide it up into about 3 or 4 specific age groups. And what I've found that has worked quite well for me is, if you want to engage, primary school kids, we do a puberty program for them in grade 5 and 6, and that's our first introduction into actually understanding that boys are important as girls, and certainly there is someone that's interested in their health and their development. So we have about 20 schools that use us as nurse practitioners that come in and do that education. We extend that then to the sort of next age group, which is, I think, is around about the 15 to 30, and this age group's really interesting because it's just the start of denial for a lot of males. And I did a session for some boarding house kids the other night, and they're all 18 or 17 or so. And, it's a pretty in-your-face discussion, which I think they need. They don't want it from their parents, as I think Helen said, they don't really want to talk to us. I've got 3 teenage boys, and as Helen said, if you get them locked in a car, and living in the country is quite good because you can lock them in the car and they will have a chat to you, and they'll spill their guts pretty quick, which is great. And it's always good to have a mate in the car because they'll spill the guts for them. So you can find out exactly what's going on with your kids. And I've got twin boys that are coming up to 17 now, and they just, it's great. I just invite a mate to hop in the car with me and I find out everything. It's magic. So but I find that from a nursing point of view is a really great time to educate and involve yourself. I mean, I did a session that was only going to be an hour the other night at 8 o'clock at a boarding house, and I got out at 11, and the boys just asked a plethora of questions. And there was no questions barred at all. It was all about sex. If I have sex 5 times, are you sure I still need to wear a condom on the 5th time? It's great questions because I'm sure it's stuff that we probably would have loved to ask somebody when we were young. And so I find that it's a good time to open the door. And these guys have all got my number. They ring me. I see them at the football. I see them at basketball. I play sport against them. And, I know these boys will come and see me, or they'll contact me when something goes wrong. So whether it's, they find a lump on their testicle, I had a bloke with a phimosis who couldn't retract his penis. And his mum sent a letter saying, to the hospital saying, thank God you actually helped him out, because this kid would have gone through life with, some debilitating, condition that, we eventually had to do a circ on him because of that. But amazing that he actually said, yeah, look, I trust him. I'm quite happy to go to see him. Wouldn't trust a GP, and found accessing the GP at that stage was not great for them. It just, found that as a bit of a blocker. So that 15 to 30 is a really important age that I see where you really want to promote access, and you also want to show that there is another point of call for men. And I think as we were saying before, the workplace is really good. And a lot of the workplace I've done in mines and even in sort of generalized businesses and providers around here has been fantastic, because what you do is you allow men to access health services when they don't really know they need them, even though they do. Because we all know that most of your risk actually occur between the age of 30 and 50. So it's fine to have men to come into clinic and see me at 55. They've already got pre-diabetes. They've probably got hypercholesterolism, and they've had it for the last 10 years. You know, their erections are starting to fade. So I just bring out my script pad and we start writing. Now that's fine, but I would have loved to see them at 30 to 50, because then hopefully they would have got that education to actually prevent the risk factors. So I think, you know, if you can get nurses out in the workplaces, you've got a target audience. They love it because it's a free thing that the workplace provides. They get a bit of time off work. They also get the opportunity to open up freely and have a good chat about their health. Obviously, screening's a great opportunity, and you can link with the GPs quite well if you need to. I still think that we've got a clinical setting, such as GP clinics that are not male friendly. I think someone said in the chat room, yep, we need to alter the times availability and stuff like that. Our clinics are available on Saturdays as well, and after hours. You do need to look at those options for men. We don't need to follow in the same footsteps that women's health do. So, you know, we are different, and men will find their services differently. The final group is that 50 plus, and most men are very happy to actually engage with health care services and also nurses at that age. And certainly my clinics are fully booked up. I run them 2 days a week, and they're 30-minute consults. And a lot of them are often referred from GPs because they know I've got a bit more time to spend with them. So men certainly engage with that. I have specific clinics as such. I mean, the erectile dysfunction or penile rehabilitation clinics, they're all booked up as well. But they're fantastic in helping men and women. And so I'll always have engagement with men and women, not just men with regards to that. So that's where I see you know, where nurses can improve the linkages between men. And I specifically want to highlight that you can't just sort of have an open slather. You've got to look at men in, you know, sort of 4 or 5 categories of lifespan, and they're all different. And I know Helen's laughing there, especially if she's probably got kids as well. But I love my boys. They're just fantastic, and they do some stupid things, but bloody hell, they're enjoyable to watch the stupid things they do, but it's all a part of learning.
Yeah,
Right.
I think I would agree that, you know, parenting isn't easy. I think the worst thing I had was the 19-year-old coming and breaking down in tears and telling me that his girlfriend was 27 weeks pregnant and she hadn't realised. And they were, you know, both at uni. Anyway, we you know, expanded the household and had the baby live with us, and she's now 7, and, you know, he finished his degree, he's an accountant, you know. So even though you think you've got it all under control, you don't always.
Yeah, well done.
Yeah. And going back there to the important transition into fatherhood piece, which is such a massive opportunity to engage men with their health. Stu, you spelled out a really nice, clear example of how to use the life stages approach with men and boys from puberty right up to old age. Particularly interested in the piece you were saying. I mean, all really interesting. One of the bits that stuck out for me was, you know, you were saying it would have been nice to be able to ask those questions when we were younger about, you know, what to do on the 5th time you have sex. I can't even imagine a world where you have sex 5 times in one night. But anyway, this is not my session.
It was a very educational conversation for me, as well as the 20 or 30 boarding house boys I had, and the boarding masters were just going, what? Yeah, and I said, mate, this is happening. You just don't, they just know how to hide it pretty well. So
yeah, on the 5th time, I wouldn't be looking for a condom. I'd be looking for a defibrillator personally. But, you know, this is the whole thing about life stages and needing different interventions at different life stages. I also particularly like the fact you raised the point of how at a systemic level, we can, simple things can make the health system more male friendly. And the simplest one being looking at our opening hours and ensuring that the services are accessible at times when men need them. It's been shown time and time again. And, you know, what I'm getting is, you know, there's Garth, I'm going to come to you next. I'm also going to shift the conversation a little bit because of time. We've got about 20 minutes. You're welcome to pick up the point we're discussing, but also the next point I'm going to make as well. So one of the sessions that sort of resonated for me this week, we were looking at health checks on Tuesday, and we had the Heart Foundation and the Stroke Foundation giving us some real sort of big population-wide data on how men were engaging with the new Medicare heart health checks, and how men engage with the sort of the biggest blood pressure check ever, which does like 400,000 blood pressure checks once a year. And they were finding that half, or in many cases more than half, of the people taking those checks were men, which is a good demonstration of that story that men aren't interested in their health or don't go and see a GP. That's not the whole picture. We have lots of examples where men are doing that. But one thing that also came out in that talk was the thing about those that need it most, those at the highest risk, are not getting those checks. So it feels like there's perhaps the fairly well and the well-resourced being checked. Maybe sometimes the unwell who are well-resourced getting checked, but we seem to most miss the unwell who are poorly resourced. And there's lots of different ways you could define that group. It could be by economic status, by geography, by background such as being a veteran, or indigenous, culturally, linguistically diverse. There's lots of different ways we could define groups who are unwell and not well resourced. And so my sort of final bit of the conversation really is that I want you to consider, how do we reach, obviously you guys are really great at reaching men, and you're really great at working with men. How do we do more to reach those men who are unwell and poorly resourced, is my sort of final round of questions. So Garth, over to you, and you can pick up the last question a bit if you like as well. I'll give you a few minutes.
Okay. First of all, it's wonderful to hear Helen, John, and Stu talk about their experiences and the work that they are doing. And I'd just make the point, it's obvious in this group. Nurses are absolutely everywhere. We work with people, from the womb to the tomb, so to speak. We're engaged in all health services, whether they be clinical services, primary healthcare services, community health services. We're everywhere, and that I think that's a really, really important point, because we're a numerous group of people. I can't remember the woman's name, but the president of the Australian College of Nursing, she's a new president, and she wrote a really good editorial in our journal recently, just highlighting that fact of how many nurses there are, not just practicing, but nurses engaged in, they've moved on and they're working in different fields as well, but they're still registered nurses, and they're still applying all of this knowledge and understanding and doing the same sort of work. So I think that's really, really important. I'll just support what everyone has been saying. As nurses, we have this opportunity. We can make an opportunity to spend more time with people. Everyone has made this point. We can spend more time with people. We can focus on people rather than diseases, and we can use our communication skills. I think Helen made the point. It's only by spending 5 or 10 minutes or maybe half an hour with somebody to gain their trust, they will eventually tell you the problem they've actually got, and they'll start to open up. So that's a huge point for nurses working with men in any sort of sphere. Another issue is, and I highlight this point to students, nurses need to be very, very knowledgeable about all aspects of health and human development. And make the point, it's so important for nurses. I don't like the term educating people, but I tell students that we have to share our knowledge and understanding with people. And through that, we empower people, and it just makes so much difference in people's lives. There's so much knowledge and understanding that we have. People have given examples here, Stu, John, and have all given examples of how people just don't know what they don't know. And so we have this wonderful opportunity to share our knowledge and understanding, give people really evidence-based information that can make a huge difference in their lives. And just a final point, I guess I'm engaged in this sort of activity now. I think we all are. Nurses play a wonderful role as advocates for men's health and fathering. And as nurses, we don't necessarily have a great deal of sort of power in the sense, political power, et cetera, not in the way that our medical colleagues do and perhaps others do. But we have a huge sphere of influence. And I know many of us, we use our sphere of influence to make changes in the healthcare system, which is what I think we're talking about. This is what we need as far as men's health is concerned. So I'll just move on then to the final point. What are the barriers? What are the problems? What are some of the solutions I see? Well, because I'm involved as an educator, I would say that nurses on graduation still lack specific knowledge of men's health and fathering. It's not a focus in the undergraduate nursing curriculum, and certainly women's health issues are, men's health issues are not. So that's an issue that I think needs to be addressed. People, it's a no-brainer. People know that health services are not run at times that are appropriate for most men. Men simply aren't able to attend, during work hours, et cetera, Monday to Friday. It's a huge issue for all services, that inability to easily access services. Let's see. I'm not sure. Just, it's been mentioned. Maybe it might be helpful if we could have more males working in nursing. Certainly, I'm thinking at the moment, I've probably got about 10, maybe 15% of my undergraduate students are males, probably a bigger proportion now than what there might have been 10 or certainly 20 years ago. Certainly that maybe that proportion needs to be increased. So what I would see as a way forward, I think we need a more specific undergraduate curriculum in nursing that focuses on men's health and fathering. I think that's absolutely critical to actually provide students with this education so that when they become registered, they're much more aware of men's health and men's health issues. I mean, just this thing about erectile dysfunction, sexuality, these subjects are so infrequently discussed. I mean, they're virtually taboo. I mean, we're kind of used to talking about all sorts of women's health issues, but seldom do men get a chance to talk about men's health issues. And we know that men get so embarrassed and they just can't talk about these things. I guess I've already just mentioned my involvement in what we call father inclusive practice. So this is a key issue across all healthcare services. We know that men are often excluded from this family group. We have in Western Australia, we have a women and children's health service, or women and infants health service. We don't even acknowledge the fact that there's another person in the family, which is usually a father. It's not necessarily always the case. So we need more out of hours and weekend health services. We need health services in the workplace. This is an issue that others have already addressed. I think it's absolutely critical. We can do screening, we can provide services for men where they are. And my final point, and I'm probably being a little bit controversial here, but I'll throw this in. I'm sick of hearing in the media over recent weeks what I would call man bashing. And I watch ABC, and I am sick of it. I've just had enough of it. I think the media are playing on this. I'm not sure why. There are a particular group of people who are doing this. It would seem that all men in Australia are misogynists and or rapists, or a combination of these things. And I think all of this negativeness about men is it's very, very harmful for men, but more specifically for boys and young men, adolescents. I am very, very concerned at the sort of messages that so many boys and adolescents are getting because of all of this man bashing crap that we're getting through the media. That's supposedly seeking to support women, but at the same time is having a major detrimental effect, I would suggest, on the health and well-being of men. So I'll just finish there.
Garth, thanks. You've raised so many powerful points there. I'm not sure what nurses can do about that cultural conversation, but thank you for raising it. It's a point that comes up over and over again, and I don't think we certainly haven't found a way through that yet. And I think it's a concern that many people share, whilst still having a great concern for the issues that impact women and girls and the harm that women and girls can sometimes experience at the hands of men. So thanks for raising that piece. I want to just pull back to your rallying call for systemic change in terms of like getting men's health as part of the education curriculum, about changing the way we deliver services, and the piece you saying about nurses can be great advocates for men's health and fathering. Well, you've just proven that right there. Thank you for being an advocate for men's health and fathering. So to our other three speakers, we've got about 2 or 3 minutes each to have your final thoughts. If you can lean into this idea of how we reach those unwell and poorly resourced men, I'd be really grateful. I'll work my way back across the panel this time. So Stuart, I'm going to come to you first, then John, then Helen.
Yeah, look, I think you're asking the question, Glenn, about unwell and poorly resourced. Is that right? Yeah. Okay. So, look, I think it's a really important opportunity for nurses to be aware that they need to get access to those people. And so, offering, once again, like we said with Helen, the time of access, the ability for bulk billing, the ability for, proper remuneration. I mean, most bulk billing clinics are seen as sort of substandard with a lot of industries and populations, but they're still offering fantastic service. And I think that's really important that we place nurses in those fields as well. And obviously, I think my point before was trying to go out and access those communities. And if you can access those under-resourced and underserved, then you're certainly going to give a better opportunity to try and get them early in their lifespan, and also early in their sort of, hopefully, their poorer health conditions, such as catching them with hypertension, catching them with early diabetes, etc. So I think nurses have, and I think this is one issue that I have with the education system of nursing, is everyone thinks, or a lot of people think, that nurses just go and work in a hospital. It's not the case. There is just masses of places you can work. I love going into the graduate nurses and just going, what you see here is about 1/10 of the opportunity that is ahead of you. If you want to do something, go and do it. So nurses can plop themselves anywhere, whether it's a corrections services, whether it's culturally and linguistically diverse populations. They can go anywhere, and we really need to promote that in universities as well. So great opportunity. I'll leave it at that.
Great, thanks, Stu. You're a great advocate for nursing and for men's health, and yeah, I take your point. Let's reach out to those that most need the support. John, you may want to take this opportunity to lean into veterans if you wish, but I won't presume where you want to go. We've got 2 minutes.
Okay. I was just going to pick up on what Stu said. Someone says to you, "What do you do?" "I'm a nurse." "Oh, which hospital do you work in?" Always the response. And then you give them an education that's, I don't work in a hospital. It's totally different. One of the things I want to touch on firstly is the Slip, Slop, Slap program was a health promotion program that worked exceptionally well with young kids. And their kids went home and educated their parents. "Mum, you've got to put your hat on. Mum, you've got to put your sunscreen on." That worked exceptionally well. So I think in terms of men's health, we need to start at a younger age. And one of the things I mentioned on Monday, for instance, was school-based youth health nurses is something we started in Queensland, and I was on the project to put one of those nurses into one of our high schools, and it worked exceptionally well until we had a change of government that decided that we needed chaplains. So we need to have that push to get the school-based youth health nurses back into the schools who can develop that rapport with the kids and do that sex education, any sort of health education that goes from there. From the veterans' point of view, what my experience is, you have to realise that when you go into the army, you have your own principles, your own morals, all that sort of stuff. When you do recruit training, you're taught to shoot or be shot. So it's very confronting that you lose your ability to make informed decisions about stuff because you've got to take orders. In the army, if you, for instance, have depression or you start to get some mental health illnesses or you have some sort of injury, you don't tell anyone because that might stop your progression within your career progression within the army. And I'm referring to Navy and Air Force as well, but it should also include police and fire, all those sorts of things that are emergency services. So they tend to hide a lot of their injuries and illnesses. And when they come out, Defence Force Health will give you a medical report that says, this is what we know. They come to the GP, and as a nurse, and you're doing the post-discharge health assessment, you're picking up the PTSD, you're picking up a whole range of personal problems. And, when you go to the hotel, where do you stand? It's always against the wall because you're always surveying what's happening and you're on guard. And I didn't realise that many, many years ago, that was the stuff that I still do that. When I go out and eat at a restaurant, I've got to sit against the wall. It's just become subconscious. So they're the sorts of things you've got to work about, but you've also then got to pick up those injuries and illnesses that they didn't declare when they were in the Defence Force, and then start the process of making a claim to DVA. One of the things I'll share with you now is that if you're in practice, any person that's done continuous full-time service of 1 day or more is entitled now to a DVA white card for mental health. What that does is give you access to psychology services, and you don't have to go and get a mental health care plan. You just do the D904 referral to the psychologist. Fantastic. But if you're clever, you can also then do a referral to an exercise physiologist for social and emotional well-being. And that's the term that I like to use instead of mental health because it's non-stigmatized. There was a lot more I wanted to cover in terms of DVA stuff, but we've run out of time. Gonna have to cut you short there, John, I'm afraid. Yeah, but the other thing is that we just need to, the focus that I see from men's health point of view is we should be on health prevention and care coordination and maintain diversity and inclusive healthcare. The other thing I wanted to just quickly say is I don't like the term masculinity. If you're a female soldier, are you masculine? But yet you're still doing the same stuff as a male soldier. I'd like to think that we start using the term of intersectional approach, meaning we're looking at a person as an individual, no matter what their race, gender, whatever. I'll leave it at that. Gotcha. Thanks, John, which links back to what, in a different way to what Garth was saying about a focus on people rather than just a focus on diseases. Helen, some final thoughts for you, if you will.
Yeah, look, I think, some great chats in the chat box. I think, everyone here today is here because they are very passionate about men's health, and we are slowly making changes. I think, one of the bigger hurdles around parenting is to let it be more acceptable for men to take time from work, and not be called pussy whipped and all that other chat that goes on. Oh, you're pussy whipped if you're taking, paternity leave. I think it's, just slowly changing the way we think about things. And look, there's some great men out there participating in family life. I mean, I'm lucky I live in a street where, the young dads do take time off. They do the school drop off, pick up, they try and work flexible with work. And I mean, I guess the one positive about COVID is more men have been at home, and there's been some quite funny YouTubes about, how men go, oh, I didn't realize it was quite so hard. And I laughed, somebody was interviewed, and this, the media get it so wrong. The dad was chatting about, how he was taking his turn at packing the lunch for the school kid. He went to the fridge and got a pre-made roll and chopped up an apple. And that was their idea of a dad participating in lunch. So I thought the media get it wrong, as Garth, commented. I think we've just got to keep chipping away. And events like this are great because we're reaching more people all the time. There's some really great men's health groups going. There's a great dads with a pram, which I think is a terrific organisation. I think, compared to, what my dad did, his journey was very different. Although, having said that, my mum did go back to work, and Dad was the one that taught me how to make gravy because he used to cook 2 nights a week. So I think we are slowly making changes, and great to see so many diverse nurses here today doing fantastic things.
Right. Thanks, Helen. Thanks to all of our panel. It's been such a rich and interesting conversation. I personally could carry on chatting with the 4 of you for another hour or 2, but we have a whole day packed, including later on, we've got Thomas Docking from Dad's Group, who run the Man with a Pram project. So they're actually on the program, Helen, if you're around. So I'm just going to say thank you to Dr. Garth Kendall, to John Brown, to Stu Willder, and to Helen Storer. If you were in any doubt before the start of this conversation, nurses clearly do play a huge role in helping to improve the lives and the health of men and boys. And I'm going to leave you with one comment from the chat box from Kath Schubach, who's president of the Australian and New Zealand Urological Nurses Society. Kath says, great session. Thank you to the speakers for their passion and sharing their experiences. I couldn't put it better myself, Kath. Looking forward to seeing you in the next session on research. But for now, to our speakers, thank you. And you're free to relax.